Hello, I'm Erica Chung, President of the Francis Payne Bolton School of Nursing Alumni Association Board. Welcome to the first of our FPB Alumni Conversations series. The conversation will be conducted in an interview format that we hope you will find to be thought-provoking, motivational, and enlightening. Our first interview will be conducted by Dr. Gloria Hilton, a double alumni of FPB and a member of the Dean's Visiting Committee. She will be speaking with triple alumni and former Dean May Wykle. Now, a bit about Dr. Wykle. May Wykle was the first African-American dean and Florence Seller Professor of Gerontological Nursing at the Francis Payne Bolton School of Nursing at Case Western Reserve University. Her extensive research contributions to nursing science have covered areas such as geriatric mental health, family caregiving, minority caregivers, and caring for patients with dementia. She also initiated educational programs internationally throughout Europe, Africa, and Asia. Her accomplishments, professional activities, and accolades are so numerous that it would take much longer than the time I have allotted to name them. During her career as a nurse and educator, May Wykle made it her mission to open up the field of nursing to more minorities. She believed that the initial low percentages of minority applicants was due to one, lack of encouragement in African American communities to pursue a career in nursing, and two, their need for financial assistance. Therefore, she pushed for an increase in minority faculty to serve as role models and collaborated with high school counselors and teachers to recruit more students of diverse backgrounds. In 2007, Case Western Reserve University's Board of Trustees created the May L. Wykle Endowed Professorship, the first endowed chair in the university's history to be named after an African American. This was in response to Dr. Wykle's commitment, healthcare leadership, and many other contributions to the field of nursing. I am so proud to welcome you, and now on to the interview. Dr. Gloria Hilton will open up by telling you a little bit about herself. She will then ask Dr. Wykle a series of questions that will give you an insight as to how she started her nursing career, the roadblocks she encountered, and the successes she achieved.
I'm Dr. Gloria Hilton today, thanks to Dr. May Wykle. I met Dr. Wykle when I was contemplating if I was going to get a master's degree or not, and was able to get an interview with her at Case. Was a delightful meeting, and I left out of that meeting with a direction, with a pathway. I was blessed to do the psych mental health program, Jerry Psych, and from there, rested a few years, and then went back to the nurse practitioner program to get my doctorate. And I focused on the educational track. Also, while I was at the Cleveland VA, I did some work at Case in faculty as well. I was one of those people that had that opportunity to do instructor and then associate professor. And it was just a wonderful experience for me to do that. So throughout my career, Dr. Wykle has impressed upon me the importance of moving forward, the profession, what it can offer to you and how great it can be. I have been just inspired by her. Looking at her encourages me to move forward. So I too continue to be active in nursing. I'm adjunct faculty at Case as well as at South University here in Tampa. And the two committees that I'm still serving on at Case, the Dean's Visiting Committee, and of course the Nurse Leadership Scholarship Committee. So I continue to be as active as possible with Case, and am always ready to give back because Case certainly has invested in me, and I'm grateful for my experiences, what I've learned. And it's always a delight when I tell somebody I'm from Case. And people immediately say, oh, there's always that awe about it. In addition to doing some teaching part-time, I also am a surveyor for CARF, Commission on Accreditation of Rehabilitation Facilities. So when we do those surveys, we always introduce ourselves, and I'm Dr. Hilton, yada, yada, yada. And of course, I don't go into much about where my degrees came from. But one person I was with just recently said, well, I'm a doctor too, but not from as prestigious institution as Dr. Hilton. The case certainly carries that, and I'm just glad to be an alumni.
Right.
So tell me, why did you choose nursing as a career? Out of all the careers, what made you choose nursing?
Well, I always had the notion, and I was prompted by my father, that I would go into medicine. So in school, I took all the kinds of courses that you need to get into medical school. And I was actually accepted into a medical school, but I spent the summer, and then it went into a year, working as a nurse's aide in Martins Ferry Hospital. And I was so impressed by the nurses. And they were really good mentors. I remember one night I was working nights, and the nurse said to me, "You're going to have to give this lady," she was in her 80s, this alcohol sponge bath, because that's what they did to reduce the fever. And of course, I really didn't want to do that, but I gave her a bath all night long. And then in the morning, her temp was down, and the nurse said to me, "You know what? I think you saved her life."
Oh,
and I
wonderful.
thought, wow. So
and
then
I didn't know about earlier. You had thought about going the doctor route.
Right. So I decided then to go into nursing. And so I worked as a nurse's aide for a year. And so they had a diploma school, but they did not accept African Americans. And so they wanted me to go to Cleveland, and some of the schools up here didn't either. So finally, because I'd worked there for a year, they let me take a test, and I passed the test, and so they let me come into nursing. I like to study. I came from a small town high school that was also integrated, because they couldn't afford two different schools. And so the focus was always, particularly for my parents, is to study, particularly if I was going to be a doctor, they said. And when I graduated with my PhD, my dad was alive then, and he said to me, "Now when are you going to medical school?" I couldn't believe it. I had to teach him about nursing and how wonderful that profession was.
As you began your nursing education, I want to know what roadblocks were in your path and how did you manage them? And you shared a little bit of that already.
Well, the roadblocks was being the first African American, and I had people, and this was a small community, and I had people in the community that was saying to me, "We do not want you to mess up because we're giving you a chance." At the same time, the Black community is saying the same thing to me. "You got a chance now, don't you mess up for the rest of us." So there was a lot of pressure on me. And when I first went into nursing, they put me in a little room at the top of the nursing residence, and I had to be there by myself because I couldn't have a roommate. And so I went through a lot of things. Like I always tell people, I grew up when bias was legal, and we lived in Ohio, which was right across from Wheeling, West Virginia. And I'll just tell you one little story, because I'm a storyteller.
And you do a great job doing
it. One day they said all the nursing students are going to go for a picnic in Wheeling Park. And then they said, "Well, what I want you to do, May, is to come stand here while we call and ask if you can come." So they called and they asked if I could come. And they said, "She's colored, but she's nice." And they said, "We don't care if she is nice. She's still colored and she can't come." Well, I thought, but my classmates by that time said, "If she can't go, we won't go."
Great.
Right. So the nursing instructor told me I should be forever grateful to them because they wouldn't go. Of course, as quiet as it's kept, I didn't like picnics that much anyway. The role of nursing has changed. I went to graduate from nursing school in 1956. So I've been a nurse for a long time. And one of the things that you go in the hospitals today and see what nurses do compared to, I say to myself, I couldn't do that today, because back in the day, we didn't have all the nursing knowledge and the science, and we were kind of under the spell of the doctor. You know, it's what the doctor knew. And now nurses have really come into their own. For example, I remember because it was a small hospital in a small town, you had private doctors. They had to teach us things like starting IVs and starting blood and putting down gavage. I mean, we did all kinds of things, took out stitches. You know, we were first scrubbing OR. And when I came to Cleveland, it was really interesting. They said to me one day, this gentleman needs an IV. And I said, oh, well, I'll start it. They said, oh, no, nurses don't start IVs. Now nurses start IVs and give blood and do all kinds of things. So you can see how the role has progressed and that you're not just, and of course we have more knowledge about it, but back in the day, you know, the most important thing that you could do is learn how to give a good bed bath. And now they hardly think about that. Right, Gloria?
As you were moving along and as a young person in your career, even maybe before you went into nursing, did you have a mentor? If so, tell us a little bit about this person and how they provide some influence, some inspiration, and whatever push that you needed to go forward.
Well, most of my mentoring and push came from my parents, particularly my father, because he thought that this was so wonderful that this hospital let his daughter in. And so he would always be very encouraging. And when I first went in, we had the weekends off, and I'd go home every Friday night and tell my mother and dad I'd quit. I'm not going back there. They don't like me. You know, I had all kinds of reasons. And on a Sunday night, I was busy packing to go back. As my mother used to say to me, well, if it's too hard for you, you don't have to do it. You can come home. So she was a good mentor. And then back in those days, mentorship wasn't the big thing. You know, you had instructors and they told you what to do, but I had a couple of instructors that I felt were role models. And one was the director of the school program. She was a new person that had come in, and she was more cosmopolite than others. And I remember she said, of course you can come into school here. And she did things like, you know, I had to have an extra cap for my hair back in those days, but she was very nice. And also the founder of the hospital was the founder of the school was Ruth Brandt. And she was the first female administrator of a hospital in the state of Ohio. And she's the one that liked to call me her pioneer. She'd often embarrass me by saying, and here's our pioneer. But she was also supportive in that sense. So I think that helped. And then when I was in the clinical area, because I'd been a nurse's aide, there were a number of nurses that I had worked with, which really taught me a lot. So it was easier when I went into the program because they taught me how to take blood pressures and temps and work with patients. So that's how I started out with mentorship. And then later on and throughout my career, I've had various mentors. I had Joan Wilder, who was at Cleveland Psychiatric Institute, who encouraged me to go back and get my bachelor's. And then later on, I had June Watt, who headed up the psych nursing program at Case. And then, of course, Rosella Stodfelt, who was the dean at the time, and invited me to come on the faculty after I graduated from the psych nursing program. So I had a few. And then, of course, while I was there under Dean Joyce Fitzpatrick, she was a great mentor. And she always helped me. She's always assigning me to do things like go to Africa and help start a master's program. Of course, Joyce. Or go to Uganda. So she was really instrumental in, she sent me to Harvard School of Business for several weeks to learn how to be a dean and to do the budget and things like that. So she was always very helpful in mentoring me later on in life. I probably ought to say that I enjoyed being the dean. when people would say, you know, being dean is hard. What do you think about it? I said, I like being the dean. And I truly did. I enjoyed it. I liked the students, and I liked working with faculty, helping faculty advance and to do things like, for example, I had a student come into my office one day and say, I got something I'd like to do, and I want to know if you would hear me out. He was very nervous. And I said, well, what is it? And he said, I would like for us to start a flight nursing program. And so we started one of the first flight nursing programs in the country, which is still going today. And it was just exciting because it was an idea that he had, and to be able to support him and to be able to get that started was one of the things that I liked about being the dean, is to be able to be involved in starting so many different programs and helping faculty look at their goals and then move toward their goals. They might say something like, well, I don't think I can do that. And I would say, yeah, well, I think you can.
So while we're talking about mentoring, is that someone that you have mentored that made an impact on you or taught you something? If so, what did that person teach you? Because we always say that mentorship is reciprocal.
Well, I think it is reciprocal, and I've had so many students that I've mentored, and also faculty that I've mentored, that I am really proud of. It's very hard to have one in particular. I know one student that person that I mentored was Diana Morris, who is now Associate Dean for Education at Case, and that was very helpful. But I've mentored a number of students, particularly minority students and minority faculty. I spent a lot of time mentoring. So it's very, I would be remiss to just pick out one, because that's what I like. I like mentoring. I did have an opportunity to serve as a mentor to the dean at community college after I stepped down as dean. And I spent a full year mentoring her and helping her get along. And so I enjoy mentoring, and I think it does do something for you. You know, if you give out, you get it back. And I still hear from a lot of students and faculty that I've mentored. You know, they send me notes, they tell me what they're doing, and they really are doing a lot in terms of, as a matter of fact, one of the students that I mentored became president of the American Nurses Association. So, you know, it's just nice to go all over the country and see students that you've had some influence on their career.
Thank you.
And of course, I mentored Dr. Hilton.
So you've done so many wonderful things as faculty and then as Dean of Francis Payne Bolton School of Nursing. We know that you work to increase educational opportunities for minorities in nursing. And in addition, you did increase minorities in the nursing faculty. Can you tell me a little bit about how you accomplished that and what you feel could improve opportunities for minorities in nursing even today?
Well, one of the things that I did was that they would say to me, well, we could take them in if we could find somebody that would meet the criteria. So one of the things that I did was when I was head of the psych department was to bring in students and have them have a semester where they could demonstrate that they were, you know, really capable and able. I never lost a single student. As a matter of fact, I can always remember they were shocked because the number of African-American students who were admitted to Sigma Theta Tau. And, you know, that's not an easy organization to get into. So, and then I did apply to the National Institutes of Mental Health for scholarships, because one of the things that minority nurses need in particular is to have some financial support, not only support for tuition, but also support for them for stipends for living. And because I think in the end, if you support them, they give so much back to the profession. So that's what I did. I brought in a number of students, and it was easier to help them when I could say, I have a scholarship that you can use. And so that was the way I did that. And in faculty, I just recruited, and I said that we have to have more minority faculty. And sometimes I got a lot of flack from it too, because the whole idea is, is this person really up to FPB standards? That kind of thing. But it worked out really well. I always tell people when we had students, we had pictures along the wall that you could begin to see the increasing number of students of not only of color, but also international students. I spent time making sure that we had more international students come into the program. We do need to have more minorities come into nursing. When I was in the small town school of nursing, I'd never seen an African American nurse, or I hadn't seen any minority nurse, of African American or Asian or whatever. And until I came to Cleveland on affiliation was the first time I ever saw an African American nurse. And she was in surgery, in tuberculosis surgery. See, they don't even have tuberculosis wings anymore. And I thought, there is an African American nurse, but she was tough. When I started, I thought she was one of the meaner nurses I ever worked. But that's because she was so strict, that she'd say. And then I worked with the African American head nurse, and she was really good. And she's one of the people that encouraged me to go ahead and get more degrees. But it's so important that we have, just like in anything, I think that cultural variety is really the tops, because it really helps you understand other people. And that's what I found in traveling around the world, is to look at other people. I just have to tell you, when I went to Africa to help start this master's program at the University of Zimbabwe, they said to me, "Oh, you're going to Africa, and you better take lots of crackers and peanut butter, because you won't be able to eat the food." Well, that's not true, because in Zimbabwe, which used to belong to England, they served the finest of British foods. You could still go out. I mean, still the people did have their suds and kinds of things. But as far as looking for, I never did have a peanut butter cracker. But I mean, because we have misconceptions of what other people do in other places in terms of looking at nursing. And with Sigma, we went around the world doing groups. We bring groups together to have them talk about nursing. And what we found is that nursing is more alike all over the world than it is different. So it was just really nice to see. And in some countries, nurses were more elevated than others. And some other countries, nurses were more, they were used to the British, you were a staff nurse, and you have to bow when you go to the head nurse, and so on. And of course, we've done away with a lot of that, because we believe in people being open and being able to talk to one another without feeling that I have to. And even in our own country, when I was a nursing student, you always got up when the doctor came in. If you were sitting in the seat, you got up, you did everything that doctors said. We even had doctors teach us, because they felt that the doctors could do a better job of teaching some of the courses. Nowadays, it's rare. If you have a doctor in, it's for a lecture or for something important, but not really depending on them to teach the poor nurses whose brains weren't as developed. And the purpose of the committee is just that, and that is to raise money and to raise funds to help bring underrepresented students into the university. One of the things that I did find is that many of the scholars do not have the money to come in, particularly into like Francis Payne Bolton School of Nursing, where the tuition is not small, put it that way. And so we decided to have a committee. We're working with Bridget Mercer, and of course, Dr. Hilton has been very involved, encouraging people to donate to that fund, so that we have enough money in the fund that we can begin to give scholarships. And so we have a really nice committee that we've had to put on hold kind of because of COVID. But because I think that helps students. And also with that scholarship, we can begin to do things like have people go out into schools and work again. And this is one of the things that I did, was to work with the counselors in schools to help minority students realize that they can become nurses, and to help them to steer them to take the right courses in high school, so that they really will have, it makes it easier for them to come into the program. And so Gloria has been with us since the start. What do you think?
Yes, I'm really, shall I say, excited about the committee and looking forward to us becoming active again as things are becoming more easy and working through the COVID,
Right.
yes, pandemic, as we say. So our goal, as you explained very well, is to gain more money for scholarships. So I'm just encouraged to seek out more people who can do that, and we get the word out, and then just be productive and go forward. You have many, many professional awards. Throughout your career, you've been recognized for excellency, and you've always just exemplified the highest. This is kind of like that other question when I say, is there one person you have mentored? When you have many awards, but is there one award that was especially meaningful to you, and why?
Well, I think it's hard for me to pick, but one of the ones that I pick is that they established the Wykle professorship at Case Western Reserve University, and I'm the first African American to have a professorship. And why I am proud of that is because we had no money just for that professorship. But Nora Hennessy, who was my person over development, said, "Oh, we can do it." And one of them said, "We'll just have 1,000 give 1,000." And so we really started with a grassroots mentorship. And so in 9 months, we raised $1.5 million to start the professorship. And I'm really pleased with that, because people from all walks of life. I had one lady who was 93 and she sent me $13. And compared to, of course, I got some bigger ones from like Forest City and university hospitals. But to me, that was a real pleasure. And it ended up, we had this big ball downtown.
It was fabulous.
That was wonderful. So I would say that that was my big, because I'm very proud of that. I also like the fact that I became president of Sigma Theta Tau International, because that was something I wasn't expecting. And so I threw my hat in the ring, and I thought, oh, I'll never get that position. And I was surprised that I did get that. And so Sigma Theta Tau taught me a lot about nursing, about international, and it also sent me traveling all over the world because it's an international organization. So I'm very proud of Sigma and what it's accomplished and how it continues to be really an institution of excellence for nursing.
Our younger nurse alumni only know of Francis Payne Bolton through the historical books or documentaries that we have. Can you relay a personal story of an interaction with Francis Payne Bolton? What was she really like, and how do you remember her?
Well, she was a woman that was had a lot of confidence, and she talked with a very deep voice, which was really interesting. And I remember being in a meeting with her and Rosella, and she really was afraid that nurses would go on and get their degrees and they would leave the bedside. So she would often say, "Rosella, remember the bedside nurse," because she was really into that. She was a very fair person, and she liked to stand on her head, because she believed that she wanted to show nurses that outside of the nursing, you need to have physical exercise and do other things. I think what I remember most about her is that she would invite the students and faculty to her home for tea. And I remember standing in line, and I was really nervous because she wanted to fill my cup of tea. She would sit at the head of the table and pour the tea. So it was we used to say, "We're going to Franny P's for tea." And so, but she was a really good role model in terms of some of the things that she did. And of course, you can learn that from her life story in terms of her being instrumental in helping the Tuskegee Airmen. She was one of the first congressmen ever to visit Africa. So she was really very much into looking at minorities in nursing and also men in nursing. I remember at a meeting when we had the first male come into nursing. Well, we had some before, but this is when I was there. We had a male come into nursing, and she would say, "Good evening, daughters, and my one son." So she really was, and she did a lot to help nursing. If it hadn't been for her and her in Congress when they passed the law pertaining to cadet nurses. And one of the things that she said about cadet nursing, that hospital schools of nursing and any other school of nursing, if you did not permit minority students to come in, then you wouldn't get the money. And so even when I was in Martin Surrey Hospital, they still had cadet nursing money left. And so I was privileged to be able to have some of that support. So she was a great woman. She's a lot of humor, but yet very serious about getting things done. Yeah, she was way ahead. Anybody that would fly in a plane with the Tuskegee Airmen. I mean, she really was. She's a person who, you say, walk the talk, and walk the walk.
Yeah.
And I think was an unsung hero, because her starting that cadet nursing program provided for many students in small towns and on the farms to have an opportunity to go into nursing. And that's what I think about the minority scholarship. It provides people who never would have had the opportunity to go into nursing. And that's what she did with that cadet nursing program. And I really loved it, because she said you can't segregate. You have to bring in, because if you segregate, then I won't give you the money, she said. And nurses back in the day did not do much research. You can start, if you look at the history, when someone started doing research. And I can remember Dean Rosella Slotfield calling all the faculty together and say, you've got to do some research, and talking about research. And my mentor, Joyce Fitzpatrick, came to my office one day and said to me, "What kind of research do you do?" And I said, "Well, I don't do research, I teach." And she said, "Well, you're going to be doing research." And that's how I got started in learning how we also have knowledge that needs to be developed and needs to be, scientific, have a scientific base for practice. Being director of the University Center on Aging and Health was critical in terms of the movement at the time, and that is moving toward understanding older adults and looking at their mental health. And so in that way, we interacted with the community. And I really believe that one of the goals of a university is to be involved in the community. So we did a lot with some of the nursing homes, and I wrote for belonged to a teaching nursing home grant that we had funded by Robert Wood Johnson. So it was a really exciting time to be able to move into an area that no one had really thought about before. So that's why we started geriatric mental health. And so I'm pleased about that. And then we did a study of self-care in Japan, so that we could make a comparison between older adults in Japan and older adults in this country. So it's been you could go forever on self-care. So I know that I worked with Carol Musil, who's now the current dean, and helped her in terms of her selecting to study grandmothers as caregivers. And she's really taken that work and had many studies that support what we do to help grandmothers, who many grandmothers are the caregivers, particularly of children. I think it's really nice to go over some of the history, because helping people to understand where nursing, and if you go way back in history and start back in Nightingale's time, to see the advance of nursing and yet understand how very smart some of those nursing leaders were. And I saw that course a case because Roselle Schlotfelt, I was the dean that I worked for, and she was really out internationally, and she had lots of ideas about nursing, and that's why she had the nursing doctorate program, because she was really a fascinating woman. But what Rosella did was to elevate nurses. She thought that nurses ought to have higher education, and she thought that's why she came up with the doctor of nursing program, nursing doctorate. Now it's been morphed into the ND, but I mean the DNP, but it was originally the ND, and nursing at Case was a 5-year program at one time, because she was really out to educate leaders. And she was really something. I remember one time Roselle was talking, and she always used these big words. And someone said to her, you know, you're just talking to common folk, and sometimes they don't understand. She said, I don't mean for them to understand. If they don't understand, they can look it up. She was always talking about excellence, and so I gave a talk about her when she retired, and I got as many big words as I could. You know, it's this magnanimous person. but her whole idea is to elevate nurses, and she really worked hard at saying, you know, let's look at the nurse and what the nurse contributes. And she once had a conference when she said the nurse advocate, I mean the patient advocate, should it be a nurse? And she was way ahead of her time, and of course it should be a nurse.
It's been a delight to talk to you. Thank you so very much.
Well, you're quite welcome. I said I'm such a storyteller, I could sit here all day and tell you stories. But I did enjoy, I enjoyed nursing, and I enjoyed the trip that I took. You know, I started out in a diploma school. I came to Cleveland. I worked in psychiatric nursing at Cleveland Psychiatric Institute. And I started out as a staff nurse, and then I became a head nurse, then a supervisor, and finally director of nursing education. So it's nice to see, and it really helps me mentor others that you can keep going if you'd like to.
A great journey.
Every time I got a degree, every time I entered to get a degree, I would look up and say, Lord, would you help me? And so then I'd get through that, and then I'd say, well, you got to help me again. So I got through going up to get a PhD. And I think that all nurses need to look at nursing, because there are so many pathways in nursing that you can go. If you like administration, you can do that. If you like clinical, you can do that. It's just such an opportunity. So I get really excited when I'm meeting someone who tells me, well, I don't know whether I want to go into nursing or medicine. I always say, let me tell you a story. Because nursing has been a wonderful profession for me, and my teaching of students has been, when you ask me about mentoring, every time I go into class, I feel like I'm mentoring all of the students. And so that's why I still continue to teach to this day. So I really think that the nursing career is just a wonderful thing. And of course, you know, I'm very biased to Francis Payne Bolton School of Nursing, and still working to get more scholarships to bring in more underrepresented students into the program.
Absolutely. Fantastic. We're just so grateful for you and your contribution. Well, thank you very much.
Well, Gloria, I'm proud of you too, because as a mentor, I could point out, look what you've done in nursing.
Thank you.